And so it is with great pleasure that I introduce to you Dr. Adrian Lopresti, who is a clinical psychologist who resides in Perth, Australia. His practice actually specializes in depression and anxiety, and he treats both adults and children. He's a member of the Australian Psychological Society. His doctorate is in clinical psychology, and fortunately, he's had a long-term interest in natural treatments. And the reason that he's joining us today is that he's going to talk about a study that he did recently about the effectiveness of using a special high absorption curcumin for depression. And so it is with great pleasure that I introduce you. Dr. Lopresti, welcome.
Thank you for having me.
Well, we're just delighted that you're here.
That's great.
So I'm going to turn that over to you, and if you have any questions, just speak up and I will reactivate the host line.
No problem. Okay, so yeah, thanks for people attending this morning, for most of you, this evening for me. So today I wanted to talk a bit about, obviously, curcumin and natural treatments for depression. It's probably the webinar today is going to be provide a bit more detail, a bit of background on depression and some of the biological causes of depression, and how curcumin and other lifestyle and natural forms of treatment can treat depression. So what I wanted to cover today was just provide a bit of an overview of depression and some of the symptoms associated with depression, and just talk a bit about how common depression is, because it is certainly a major problem in our society. I wanted to, in quite simple terms, hopefully everybody will, I won't bore people too much with the biology of depression, but I think it's really important for me to spend a bit of time talking a bit about the biological causes of depression and how some of the lifestyle and natural treatments can correct some of these biological pathways. So there's certainly a lot of different options available to people who are suffering from depression. And then the latter part of the webinar, I'll talk a bit about, obviously, my research study and other studies that have been conducted on curcumin for depression, and also other natural treatments for depression, other nutraceuticals that have, where research has been conducted. So in terms of depression, I've broken it up into several categories. So there's depression symptoms associated with emotional changes, and obviously sadness and low mood is one of the most common symptoms that occur in depression. And the sadness and low mood is more than the sadness that occurs, for a few hours or a few days. So it's quite persistent, and in actual fact, to be diagnosed with depression, it needs to occur for most days for at least a couple of week period. There's often feelings of guilt that occur with depression too. There's irritability and frustration, and this is particularly the case with, I find, with men in particular. They don't necessarily express the sadness and low mood, but it's more through irritability and frustration, and even teenagers is the same here too. There's a general lack of confidence. Often the lack of confidence may occur before somebody suffers from depression, but it certainly worsens when somebody's experiencing depression. There's a sense of indecisiveness, inability to make a decision. There's feelings of disappointment, and people can really feel overwhelmed, and that can result in a lot of avoidant behaviours. And for some people, in actual fact, for some people, they don't necessarily express feeling sadness, but they more talk about feeling numb or having a flat mood, and that can occur too. Stress and tension is another common symptom associated with depression. In actual fact, people with depression are more likely to suffer from anxiety disorders, and vice versa. People with anxiety can also suffer from depression. So there's a lot of comorbidity between the two conditions. Often if you treat one, the other will improve. There's also several behavioural changes that occur with depression. There's reduced social activities. There's a reduced engagement in pleasurable activities, so people kind of stopped engaging in those activities that they've previously found enjoyable. There's often a withdrawal from others and spending time alone at home a lot. Often people will spend time in their room or basically just on their own. There's an increased time to complete tasks as people kind of find it difficult to pay attention and stay on task. There's an increased sense of procrastination. The drug and alcohol use can increase, and that's often used as a coping behaviour. Suicidal behaviours can occur, not in all people who suffer from depression, but there certainly can be there, and self-harming behaviours. In terms of thoughts, there are negative thoughts that people experience, and these thoughts are often about oneself. They can be about the future, or they can be about the general environment. Suicidal thoughts and thoughts about death can predominate. Now, it's not uncommon for people to have thoughts about death, but in actual fact, some studies kind of indicate that at least 50%, about 50% of us have, in some period in our life, will have thoughts about death. But with depression, it can be they can become preoccupied with it. From a physical health point of view or a physical point of view, fatigue and tiredness is a common symptom associated with depression, and often sometimes people will visit their doctors complaining of fatigue and tiredness, and the doctor may kind of pull out the prescription pad for an antidepressant, which may sometimes be correct, but I think sometimes we also need to look at other potential causes of fatigue or tiredness in people. The symptoms of feeling run down or unwell. Headaches and muscle pain can occur, and this is particularly the case with people with anxiety disorders and high stress. Digestive problems can often occur, stomach upset or nausea. Sleep problems are very typical of depression, and that can comprise of either not sleeping enough or insomnia or hypersomnia, so sleeping too much. Sleep's really important because a lot of the research shows that people who suffer from depression had sleep problems prior to experiencing the depressive episode. There's a loss or change in appetite. So again, here, like sleep, where there can be increased or decreased, appetite can be the same. There can be an increased or decreased appetite. And the same again with weight. So some people with depression can lose weight, and others may gain weight. So people don't necessarily experience all of these symptoms, but there's generally, these are the more common ones. And finally, the lack of interest in sex or sexual dysfunction can often occur too. So how common is it? Well, in the last 12 months, about 6 or 7% of us have suffered from depression, so it's really quite common. About 10 to 15% of us will experience a depressive episode sometime in our life. Women in particular are quite susceptible, have a higher risk, of depression. About 70% more likely to suffer from depression than men. And I think certainly I suppose an area that's not considered a lot is youth depression, and some of the research indicates about 15 to 20% of youth will suffer from depression prior to adulthood. And I think this is really an area that requires a lot more attention, particularly in areas of kind of natural treatments for youth. By 2020, depression will cause greater disability than any other mental or physical disease. So while other physical conditions and get a lot of media attention, certainly depression is one of those things. Certainly is one disorder that we really need to look at, because it certainly has an impact on ourselves and on our family and on our functioning. With regards to the biological causes of depression, I'll just quickly kind of go over it. But initially, depression was believed to be associated with neurotransmitter disturbances, one neurotransmitter being serotonin. But what we've found over the years is that it's far more complex than that. And neurotransmitters are one cause, and I'll go through each of these in a bit more detail in the following overheads. There's often what we call HPA axis disturbances that can occur. Inflammation is quite common, extremely common in depression, and that's what led me into looking at curcumin as an antidepressant. Oxidative stress, and as I said, I'll go through all of these. Brain neuronal changes, there are often changes in the brain that occur with depression, and there's mitochondrial disturbances. So if we think about neurotransmitters, what are they? Neurotransmitters are chemicals in the brain that transmit signals from one neuron or brain cell to another. And this is the diagram of the two neurons or two brain cells, and the red balls there depict the neurotransmitters. And we need those to transmit information from one cell to another. And when there's deficiencies in that, then communication often impacts, and it can really affect mood. So examples of neurotransmitters include serotonin, which is received a lot of concentration, a lot of attention in depression research, dopamine, GABA is a neurotransmitter that's often associated with anxiety, and acetylcholine is often looked at in areas of kind of attention and concentration. So if we think about some of the symptoms of serotonin deficiency, so if you're low in serotonin, here are some of the symptoms that may occur. There's a loss of pleasure in hobbies and interests. So as you'll notice, there's going to be a lot of depressive-related symptoms. There's feelings of inner rage and anger. So some of the research indicates that low serotonin is also associated with anger. There's feelings of depression. There's difficulty in finding joy from life pleasures. Depression when it is cloudy and when there is lack of sunlight. So the seasonal affective disorder or winter blues is often referred to. There's a lot of enthusiasm for favourite activities, and not enjoying favourite foods can occur, is often a reported symptom with serotonin deficiency. Not enjoying friendships and relationships. Serotonin deficiency can also affect sleep and the ability to have restful sleep. Obsessive thoughts, people with obsessive compulsive disorder are thought to be low in serotonin, and it's one of the factors that occur in OCD. Migraines is another symptom that's often associated with serotonin deficiency. And so as you can see from this list, there are a combination of numerous symptoms that can be triggered with serotonin deficiency. And this is what led researchers to look at medications, and a lot of medications target serotonin deficiencies called SSRIs. And I'll talk a little bit about that later on. One of the other neurotransmitters that are associated with depression is dopamine, and low dopamine is dopamine is our feel-good neurotransmitter, and people who are low in dopamine could report a reduced ability to feel pleasure. They may report feeling flat, bored, apathetic, and have low enthusiasm. Again, depressed is another symptom. Procrastination, that motivation and drive to do things is just not there. There's a difficulty with attention and concentration, and dopamine is one of those neurotransmitters that's often associated with attention deficit disorder too. People with dopamine deficiency often crave uppers, caffeine, nicotine, diet soft drinks, sugars to get them going. They're prone to addictions, and there's a low libido or impotence that can occur with dopamine deficiency. And mental and physical fatigue is often another reported complaint with dopamine deficiency. So people with feelings of kind of burnout often have symptoms of dopamine deficiency. And rather with serotonin, it was kind of impaired sleep. With dopamine deficiencies is excessive sleep, and they find it difficult waking up in the morning. Unrefreshing sleep takes a couple of hours for them to get going. So you've got so that was just two neurotransmitters that are often associated with depression, and I want you to kind of remember some of these causes as I go through, because you're going to notice that a lot of the a lot of the natural treatments I'm going to talk about actually target a lot of these biological causes. Now, HPA imbalance, HPA is our hypothalamus pituitary adrenal axis. So our brain kind of telling our adrenal glands to release hormones, and those particular hormones are cortisol and adrenaline in particular, that are associated with our fight or flight response. So it's when we're in danger, it's our HPA axis that gets triggered. Our body releases adrenaline, which is the fast acting, to motivate us to either fight or flight, and then the cortisol is more kind of slower release, sustained stress hormone. With depression, there are imbalances in depression, but there's kind of inconsistencies in the research. For most people with depression, there's a hypersensitivity, meaning that they have a hypersensitive stress response. Their HPA axis gets triggered too easily, or the adrenaline or cortisol gets levels of it too high, or they stay high for too long. And then there's a subset of people with depression who have a hyposensitive HPA balance. So basically that means that their stress response is just not reactive enough. And you often hear the term adrenal fatigue. That's people often refer to in this area. So with regards to depression, there's an increased stress response in melancholic depression. So melancholic depression is people who experience symptoms of anhedonia. They don't kind of experience any positive affect, or their mood is generally quite flat. The lack of mood reactivity. There's often a severe weight loss or loss of appetite. The psychomotor agitation, or sort of quite agitated, or the slow movement retardation. There's early morning awakenings, excessive guilt, and worsening mood in the morning. So they're a subcategory of depression known as melancholic depression, and the research seems to indicate that they're associated with an increased stress response. Now, a decreased stress response, however, is associated with another subtype of depression called atypical depression. And I want you to kind of remember atypical because we found it quite an interesting finding in our Curcumin study. And with atypical depression, people report the ability to feel cheered up by pleasant events. So they can feel good when they're experiencing positive events. There's often weight gain that occurs or increased appetite. There's hypersomnia, so meaning they're sleeping too much, and they can have symptoms of quite sensitive to interpersonal rejection. There's also seasonal depression, or is often associated with, or the winter blues is often associated with a lowered stress response. Climactic depression, or depression during the menopausal period, is often associated with a lowered stress response. So we've got differences in the stress response, but that's certainly an important factor with depression. In terms of inflammation, now inflammation is not a bad thing. Often it kind of gets a bad rap, but the reality is that it protects the body by isolating damaged areas, attracting immune cells and molecules of the site, and in later stages promotes healing of affected tissues. So without inflammation, wounds or infections just would never heal, so we need inflammation. And acute inflammation is short-lived, lasting only a few minutes or days. It's really positive and healing. For some people, though, they experience chronic inflammation, may last weeks, months, or years, and this is often a problem because it can cause damage when it occurs for too long. So too much of a good thing can certainly cause problems ongoingly. So one of the most interesting findings, and this is what led me to the Curcumin study, is that because Curcumin is a really useful anti-inflammatory, is that it's pretty much confirmed that several mental health disorders, including depression, but even bipolar disorder and schizophrenia, seem to be associated with a disturbed inflammatory immune response. If you measure markers of inflammation in their bloods, they have high levels of markers of inflammation. Now, we don't know what's causing the inflammation necessarily. I suspect it's a combination of lifestyle and nutritional factors that are really important, but that certainly seems to be what's occurring. The other biological cause I talked about, I mentioned earlier, was oxidative stress. And what is that? Oxidative stress is an imbalance in free radicals compared to antioxidant defenses, and that leads to oxidative stress. So prolonged oxidative stress causes damage to all cells in the body, including those in the brain. So we have free radicals in our body, and then we also need antioxidants to kind of combat those free radicals. And often what we're finding in depression is that there's increased oxidative stress. And oxidative stress can be a problem because it affects several of those pathways I mentioned earlier. Oxidative stress can affect neurotransmitters, it can affect the HPA axis, it increases inflammation. So one of the things we need to kind of think about with depression is that all these biological causes are interconnected. One will affect the other. So rather than just kind of treating serotonin deficiency, we need to kind of look at, well, what's causing the serotonin deficiency? Maybe it's associated with inflammation. Maybe it's associated with oxidative stress. We know that HPA axis or high stress response will also lower serotonin too. So that's oxidative stress over time that causes oxidization, and this apple, over time you see the damage that occurs. And we're seeing that it can cause damage to cells and neurons. One of the other things that we're finding in depression is that all mental health disorders are associated with reduced neuronal growth factors and increased neurodegeneration. So if we measure proteins in the blood that are associated with brain growth, we see that there's lower levels of these proteins in blood with depression. And we also see changes in the brain. So we see changes in the hippocampus, the amygdala, the prefrontal cortex, and various other areas of the brain that occur. Fortunately, we know that lifestyle and nutritional and other factors can certainly promote brain growth. I suppose promote brain growth again. Finally, the last one we're finding in depression is that there are problems in with the mitochondria. And the mitochondria are the cell's power producers. They produce the energy in our cells. And they're also involved in other cell processes such as cell division and growth, as well as cell death. And diseases in mitochondria can affect the whole body, the brain, the heart, the liver, skeletal muscles, kidneys, etc. And disturbances in mitochondrial activity are commonly found in mental health problems. So I hope I have bored you all to death with regard to some of the biological causes, but I think it's really important for us just to understand that it's just not as simple as going, okay, let's increase serotonin through taking a medication or a supplement that just targets serotonin. We need to kind of look at the whole gamut of potential causes. So what disturbs these biological pathways? Well, there are numerous factors. Stress and trauma in the early years can affect these pathways. So if so research kind of shows that if kids are exposed to stress or trauma in the early years, some of these dysregulations can occur in these pathways. We even know that if mum was stressed during pregnancy, that could also impact on the child. An unhealthy diet, which I'm hoping is getting a lot more attention now in the area of mental health, but still a neglected area, but we know that an unhealthy diet will affect these pathways, and in particular, a good diet is anti-inflammatory, whereas a poor diet is pro-inflammatory, and obviously our diet impacts on kind of our antioxidants and so forth. Nutritional deficiencies can affect these pathways. Physical inactivity can do it. Smoking and other drug use can affect these pathways. So when I'm seeing people, I'm kind of looking at, and with people with depression, I'm looking at all these potential causes. I'm going, oh, okay, we know that there's all these potential biological factors going on. What can cause them? Poor sleep, chronic severe stress, obesity, which can be quite inflammatory, unhelpful coping skills. And sometimes we can engage in coping strategies that feed our depression, and then just kind of adds it and continues from there on. Genes, inflammatory diseases, diabetes, metabolic syndrome, cardiovascular disease, cancers and so forth, they have a strong connection with depression. And inflammatory states, so illness will affect these pathways. And even after postpartum, so often women, we've noticed with postnatal depression, they have high levels of inflammation going on. So what's the solutions to correct these pathways? Well, it's the opposite to what I've just mentioned. So eating a healthy diet, and that can be different based upon different people. So, but generally, I certainly recommend that people eat food that doesn't come out of a box. Exercise is really important. Having good balance here. Too much exercise can be damaging too. So we need to kind of ensure that there's a good balance there. Normalize sleep. Sunshine is extremely important. A healthy weight. Psychological and relaxation therapies seem to affect these pathways. Interestingly, antidepressants, they also affect these pathways. Now, I'm not anti-antidepressants. I think within a comprehensive treatment plan, they can serve a really positive role, but they shouldn't be the sole treatment for depression, which is unfortunately what's happening. Anti-inflammatories and antioxidant agents, either pharmaceutical and nutraceutical, affect these pathways. There's been some interesting research about some pharmaceutical anti-inflammatories which seem to have positive antidepressant effects. The problem is with pharmaceutical anti-inflammatories, it causes a lot of gut problems over time and several other side effects. Reduce stress and having a spiritual connection, whatever that may be for somebody. So all these pathways or changes can then lead to improvements in these pathways, which then lead to improvement in mental health. So this is just a figure that I've just highlighted. Is depression, and there's obviously the imbalances in all those different pathways. So this is how I'm often thinking when I see somebody with depression. I'm looking at, okay, let's look at the balance. Let's try to get the balance towards positive mood. Now, some people, the balance is really towards depression. So we need to look at numerous changes that occur. That need to occur. For others, the balance is not so out, so maybe just a supplement can work, or just exercise can work. But often it's a combination of a few different things. So if we look at a healthy diet, that will help a bit. We improve their sleep, help a bit. Learn effective coping skills. Minimise stresses. Obviously, we can't avoid them, but how can we minimise or deal with them more effectively? Engaging in pleasurable, meaningful activities. You don't hear that a lot. Nobody makes money on that, unfortunately, but engaging in pleasurable activities can affect these pathways. Relaxation, engaging in regular relaxation practice, whatever that may be for somebody. Having good support systems and using those support systems. Ensuring that there's a good balance of essential nutrients, which I'll talk a bit more about in a few minutes. Healing herbs and supplements. Medication, but you see here as medication is part of the solution. Physical health, improving our physical health, treating any diseases or making sure we manage any medical problems that we have appropriately. Exercise, really important, and then our spiritual health. Now, I haven't placed these in no particular order, but they're a combination of a whole bunch of different things, and this is how I'm looking at depression. It incorporates all these different factors. So solution one is increase social engagement and pleasurable activities. So not much more I need to say about that, but if we dedicate our mind on things that give us pleasure, we move our mind away from things that give us or how sad we're feeling, or some of the difficulties that are occurring with our life. And I know that's often easier said than done, but it certainly is something we need to look at. Unfortunately, the problem occurs is that when people are depressed, they do less. And when they do less, they feel worse. When they feel worse, they do even less, and there's a spiral downward. Reduce stress and improve coping skills, and that can occur through learning skills yourself, or through psychological therapies, or seeing a psychologist or therapist. Improve diet and restore nutritional balance, extremely important. And we know that certain nutrients are really important for depression. Now, this is not an exhaustive list, but some of the nutrients that are really important for depression are folic acid, B vitamins. Iron is really important, so we've got to make sure that people aren't suffering from iron deficiency, which is often what I'll ensure that, particularly women, I'll make sure that they are tested for iron deficiency. Antioxidants are quite important. Amino acids, which are the building blocks to neurotransmitters. Omega-3 fatty acids, which come from, particularly from fishes, gets the best source. Vitamin D. So they either can be through supplementation, but I certainly encourage people through sunshine. I just want to talk a bit about how serotonin is made, because that will link in with the importance of the nutrients. Sorry, it's all appeared as one. Okay, so if we think about how neurotransmitters are made, we first eat protein, and then our stomach breaks it down. We need stomach acid to break that protein down. And some of the nutrients required for breaking down protein are zinc, vitamin B1, and vitamin B6. Now, if we're deficient in a lot of those, in any of those nutrients, then that can cause a problem because we're not breaking down protein appropriately. And then the protein breaks down into one amino acid called tryptophan. And we need this enzyme in our body called tryptophan hydroxylase. And this enzyme requires several nutrients: vitamin B3, iron, magnesium, calcium, folic acid, are all really important for producing tryptophan hydroxylase. Now, if we're deficient in any of these nutrients, the enzyme doesn't work as effectively, and we're not converting tryptophan into the next step, which is 5-HTP, or 5-hydroxytryptophan. So then what we need is then there's another enzyme that called an L-amino acid decarboxylase, and that requires zinc, magnesium, vitamin B6, and vitamin C to convert it into serotonin. So you see how this whole process, the nutrients are really important. Are we eating enough protein, firstly? And then are we breaking it down, secondly? And do we have the nutrients required to break this, for these steps required to make serotonin? And that's really important. So you often find that people with zinc deficiency or vitamin B deficiency, folic acid, often they're associated with depression. Oh, something's going on. Okay, it doesn't like it. Okay, same deal again. So again, dopamine again is produced similarly from protein, and again we require all these nutrients to break down protein to eventually make dopamine. And again, iron, folic acid keeps coming back up, vitamin B6, magnesium, all really important nutrients to produce dopamine. So often I'm looking at, okay, well, what may be causing some of the neurotransmitter deficiencies? Let's look at diet. Let's look at any particular nutrient deficiencies that might be affecting dopamine production. Sorry, I think I need to just keep pressing the button for this work through. Okay. Antioxidants are really important for from a dietary point of view, and as I said earlier, oxidative stress is a cause or a biological factor associated with depression. So it makes sense to eat foods high in antioxidants. None of these come in a cereal box. None of these, they're all manufactured naturally. Obviously, we can then also get into the argument about freshness and organic foods and vegetables and so forth. But certainly, I talk about just firstly just getting the essential vegetables and fruits in first, and then kind of working from there. Solution 4: optimize physical activity. So physical activity such as gardening and walking for as little as 120 minutes a week was associated with a 63% reduced risk of developing future depression. Really, really important. Again, not one that gets a lot of publicity or even a lot of research. Can't patent physical activity. Exercise moderately more effective than a control intervention in reducing symptoms of depression. And exercise is as effective as antidepressant medication for the treatment of mild to moderate exercise. In several studies that's been confirmed. Improve sleep. I can't emphasize how important this is. So working on proper sleep hygiene is extremely important, and even taking certainly there's several natural nutraceuticals that can improve sleep too. Treat nicotine, alcohol, and other drug problems, or minimise exposure to them is obviously one of my goals. Treat or manage medical illnesses. So there's certainly a high comorbidity between medical illnesses and mental health problems: diabetes, cardiovascular disease, obesity, metabolic syndrome, dermatological conditions, cancers, digestive problems in particular. These are all associated with the increased risk of depression. And because they affect all those pathways that I mentioned earlier. They cause inflammation, they affect nutrient deficiencies, they affect neurotransmitter levels, and so on and so forth, and other autoimmune diseases. They're all linked with the biological causes. Pharmaceutical medications is always an option. There are certainly SSRIs, NRIs, tricyclic antidepressants, and mood stabilizers that can be used for depression. The problem is that they have several side effects associated with headaches, digestive problems, sleep problems, nausea, and sexual dysfunction are some of the side effects associated with them. For some people, they may be required, particularly in the short term, to help them be able to make some of the changes they need to make. But they're there, and I need to just obviously mention them. Now, finally, we'll talk a bit about some of the natural supplements that are out there. I'm just going to talk about the ones that have a greater scientific kind of research supporting them in the area of depression. So there's certainly a whole range of different supplements that can affect. They may be positive for mood, but I'm just going to choose a selection of them. So first one being omega-3 fish oils. I recommend that any people with mood-related disturbances, or even people in general, take a good quality omega-3 fish oil. Several studies confirm that fish oil supplementation is beneficial for depression. It's not the sole treatment, but I think that if you think about all these changes, if you think about making 10 changes and they all help 5% each or 10% each, it will result in significant effect over the long term. Some of the studies show that preparations of greater concentrations of EPA compared to DHA have greater antidepressant effects. So I generally recommend that people take fish oils with higher EPA levels. In particular, supplements containing concentrations of EPA 60% greater than DHA is the most effective. So just look on the back, and when you're choosing a fish oil, particularly for mood-related effects, then you might want to choose one with high levels of EPA. And it's about 1,500 milligrams of EPA plus DHA daily. That's recommended for mood. B vitamins are important, so I think that's another thing that I often look at. I often recommend a fish oil, a good quality fish oil, and a B complex for people who may have mood-related problems. And particularly folate, vitamin B12, and vitamin 6 are also associated with depression. Now, these are essential for energy production and neurotransmitter metabolism. So that figure I showed you before, a lot of the B vitamins are associated with the production of neurotransmitters. So my recommendation is take a high-quality B complex daily. St. John's wort is probably the most commonly known natural antidepressant there is. It's been used for centuries, and it's quite popular in Europe, and superior to placebo, as effective as conventional antidepressants, and better tolerated. The studies, several studies, I mean, it's pretty much confirmed that St. John's wort is an effective treatment for depression, but not so much with people with severe depression. So mild to moderate depression is where St. John's wort has its effects. The issue with St. John's wort is that the quality of St. John's wort can vary, so it's really important that if you do choose St. John's wort, you try to choose a high quality, reputable one. SAMI is another one that's received quite a bit of research in the area of depression. Naturally occurring substance produced from methionine. Majority studies positive, and it actually can be quite effective for people with more severe symptoms of depression, so that's another good option for people. Well tolerated, and can enhance the effects of antidepressant medications. SAFFRON is another one which actually doesn't get a lot of attention, but pretty much SAFFRON looks like a really good antidepressant for people too. So it's been compared to antidepressants and as effective as antidepressants and better than a placebo. And a good side effect profile. A little bit of research on RHODIOLA, and that's one that is some studies for symptoms of burnout and depression, moderate clinical research, helps with stress-related fatigue and burnout. So I'm just rushing through that, so I'm mindful of time. So improves physical and mental performance, has a relaxing effect, improves energy and concentration. So in terms of curcumin, curcumin is the most active compound of the Indian spice turmeric, comprising 2 to 8% of most turmeric preparations. It has multiple biological effects in the body, and it influences all the biological pathways associated with depression. So all those biological pathways that I mentioned earlier, curcumin influences. So that's what led me to look at the antidepressant effects of curcumin. If it affects all those biological pathways, then it would make sense that it may have an antidepressant effect. So it affects neurotransmitters, oxidative stress, it's neuroprotective, it's a potent anti-inflammatory, it also affects mitochondrial production, and it seems to also moderate the stress responses. Some studies show that it lowers cortisol, which is our stress hormone. The problem with curcumin is that it's poorly absorbed in the body. So there's been several companies that have tried to look at how to increase the bioavailability of curcumin, and there are several options available. The one that I looked at was BCM95, and I particularly looked at it because compared to standard curcumin, it was had a far better absorbability and even better than a curcumin lecithin piperine formula. So it had high bioavailability than those formulas. So what are the studies? There's been 4 studies so far. There's one, a 5-week study. They compared, group 1 had antidepressant and a placebo. Group 2 had an antidepressant and 500 milligrams of standard curcumin. The finding was that there was no difference between the groups. It's having the curcumin in addition to the antidepressant provided no benefit. Flaws of the study, too low a dose. I think 500 milligrams is probably not the way to go, particularly for a standard form of curcumin. 5 weeks, I think, probably needs to be longer. And a standard form of curcumin, I think, would have been far better to look at one that has greater bioavailability. Study 2 was a 6-week study, and group 1 received antidepressant only, fluoxetine. Group 2 had antidepressant and 1,000 milligrams of the curcumin extract, the BCM, same one that I used. And group 3 had BCM95 only. And the finding, there was no difference between the 3 groups, meaning that curcumin was as effective as the antidepressants. So 6-week study, really positive findings. And there was a non-significant trend, meaning that curcumin and a combination of curcumin and antidepressant was more effective, but that it wasn't significant enough to say that. So it needs to be a larger study to confirm that. There were flaws with the study. It wasn't a double-blind study, so volunteers knew what they were taking, which I think is a significant flaw. It's really important that people don't know what they're taking, so that reduces the placebo effect. And there was no placebo control, so I would have included another group of just placebo only. And too short a duration, again, I think 6 weeks, I'd like to look at 8, even 12 weeks. Then there was my study, which is an 8-week study. It's a randomized double-blind placebo-controlled study on 56 depressed volunteers. Group 1 took curcumin as BCM95, 1,000 milligrams a day, and Group 2 took a placebo. The findings, there was no difference between the 2 groups in the first month of treatment. They all got better in the first month, which was getting initially a bit frustrating. I was hoping to see a change, obviously. But what we found was, though, in the second month of treatment, people on curcumin continued to get better, but those on placebo either stayed the same or got worse. So it seems as though the placebo response would last about 4 weeks, but it just didn't extend from there on. And curcumin was actually especially effective for people with atypical depression. So remember I talked about kind of atypical depression and some of the symptoms associated with that. So curcumin seems to have been more effective for them. Study flaws, there were flaws in my study. It's probably the most strongly controlled study, being a randomized double-blind placebo-controlled study. But 70% of the volunteers had recurrent depression, so it was quite a hard core group of people long-term depression who participated in my study, which was going to affect the results. And approximately 35% of people on antidepressants. So, although this was stabilised, so they weren't allowed to change their antidepressants through the course of the treatment. But it would have been nice to either compare with an antidepressant group or people without antidepressants. So we need to replicate this study with a larger and differing doses. And that's what I'm hoping to do in the future, is replicate this study with a larger sample size. Just recently, another study's actually just come out, 6-week study. Group 1, there was antidepressant only. Group 2 had antidepressants plus a curcuminoid piperine combination. And their finding was that there was great improvements in curcumin and the antidepressant group. So people who took both, the antidepressant plus the curcumin, did better than those on the antidepressant only, which is really a positive study, which goes against the first study where they didn't find an effect of adding curcumin. This was a larger dose, 1,000 milligrams versus the 500 used in the previous study. There was a flaw with the study, is that it was an open label design, so both the volunteers and researchers knew what they were doing. So personally, I think it would have been far better to have group 1 having antidepressant and placebo, and then comparing the two so people didn't know what they were on. But, you know, the results are certainly positive. And so basically 3 out of the 4 studies are some positive findings and so far. So what's my conclusions about curcumin? Should it be recommended as a first line of treatment for depression? It's an extremely promising nutrient, but not yet, not as a first line treatment anyway. I wouldn't take curcumin as a sole treatment for depression. More high quality clinical studies are required. However, given its extensive health benefits, there's probably no harm in taking in conjunction with the other recommendations that I've mentioned. I think it's certainly useful for people. It would be helpful for people to try and see whether it does work. And the studies are useful, positive, and need to be extended with larger treatments, larger groups, and so on and so forth. But I think that there are certainly some positive. It's certainly a positive nutrient, and all I can say is kind of watch this space. So I'm hoping to replicate this study with a larger sample size over the next couple of years, and hopefully be able to publish the results in 2016. So we'll see how we go. Okay, sorry to rush through that. I was just mindful of time, so thank you very much, and I'll pass on to Cheryl.
Well, thank you so much, Dr. Lopresti. It was absolutely fascinating. I'd actually never heard that information about the differences in symptomology depending upon which neurotransmitter is most impacted, like the differences between serotonin and dopamine. And I really appreciate all your overview of the clinical research as well. We have a lot of questions already in the queue. So let's jump in. The first is that we have an individual whose 12-year-old son has been diagnosed as depressed, and it's related to his learning disability, and she's looking for non-prescription alternatives to help him. So in this case, would curcumin be a good intervention?
Okay. I've actually just written a paper on natural treatments for children, for youth. Unfortunately, there's not a lot of research, good quality research for natural treatments for kids with depression. I'd probably recommend the first thing would be the omega-3s. So a high dose, good quality omega-3 fish oil would be a way to go. And again, I think curcumin would certainly have some potential as an option to try it, but I'd try more the omega-3 first, and then obviously looking at kind of diet and so forth. But curcumin, may have some benefit from that point of view. Then there's some kind of research that also kind of may help with attention, but there's no clinical-based studies on that yet. So it's definitely worth a try.
Here's a question about the study you conducted on the BCM95 curcumin. They're asking the individuals in that study, were they also taking other nutraceuticals? So some of them were, not a lot of them were taking other nutraceuticals. If they were taking nutraceuticals, one of the conditions was that they needed to have been on a stabilized nutraceutical or pharmaceutical regimen for 4 weeks prior to beginning the studies, and they weren't allowed to change it during the study. If they did change it, obviously, then they were withdrawn from the study. So some of them were on a multivitamin and fish oils, but they didn't change throughout the course of the study. And so it's not like they were all taking, the only thing they had in common was that they had depression of some type and were taking curcumin.
Yeah, and there was no difference between the two groups with the placebo and the curcumin, so yeah.
So, yeah, for the first week. And then you said that the first 4 weeks and the second 4 weeks is where you saw the differences.
Yeah, with the change, yeah. So, sorry, there was no differences with the amount of people taking the natural substances between the two groups, but in terms of curcumin, absolutely, there was from 4 weeks onwards. It seems to me that curcumin's maybe a more slower acting, because of anti-inflammatory effects, maybe that it needs to kind of reduce inflammation first, and then that will then affect all the other pathways and the neurotransmitters. So that might take 4 weeks or so to start kicking in, and maybe even longer. So.
So I suppose that one could be hopeful that with longer-term use, although we don't have the research on it yet, one might see even more profound benefits.
Yeah, I'd love to have a study for 3 to 6 months, but unfortunately they're all very difficult to do that. To have people kind of stick to it for 3 to 6 months is often quite difficult. And I'd love to kind of look at curcumin as a preventative for depression too. I think it has some merit there, but no research yet.
That's a perfect segue into our next question, which has to do with family history of mood disorders, which might be safe as sort of a baseline preventative. They're very interested in the curcumin.
Yeah, absolutely. As preventative, I think is probably the way to go. Excellent. And adding spices and so forth to our foods, including turmeric and other spices too. So.
Here's a question that said one of the studies was on curcumin with piperine. Are you concerned about using piperine in your practice because it interacts with so many prescription medications?
So I generally, only if they're on the medications, obviously. So not everybody's on the medications, but I think that's where you need to just be a bit mindful of, because there can be some interaction effects. So that's why I tried to use more like the BCM rather than a piperine formula.
Here's a question about the curcumin dosing. In your study, was it 1,000 milligrams one time a day or 500 milligrams twice daily?
It was 500 milligrams of BCM 95 twice a day. So that doesn't translate into 500 milligrams of curcumin, but it was 500 milligrams of BCM twice a day, once in the morning, once in the evening, with or without food.
And here's a person who said that, first, did you say that your paper, you're still preparing your paper on children, or has it already been published?
No, I've prepared it and it's now under review, so that could take months for it to get published, so it depends on...
Because you have a lot of people interested in that paper. There's several that have said, can we have a link to the paper? So pretty soon.
It'll be a few months away, I need to be reviewed first, yes.
And then how about research specific to people with brain injuries? I know that people who have brain injuries are more prone to depressive disorders. So and has any of the research that you've done yourself or that you have reviewed looked at these issues with people who have brain injuries?
Not in the area of depression, no. So I can't really comment on that too much. But I think certainly that's where, because of the curcumin's, I suppose, neurogenic effects, it may have some merit there, and certainly curcumin's used as they're looking at research in terms of curcumin for Alzheimer's and dementia. So I think there may be some merit in using curcumin for people with brain injuries.
Excellent. Here's a question that they're interested in the differences between BCM 95 curcumin and other types of curcumin. So I know it's curcumin blended with turmeric essential oil that has published human papers showing much better absorption than plain curcumin. Are there other differences that caused you to choose that for your study?
No, it was primarily that. There was there's a couple of different options. There's obviously the BCM 95, which is a good, but pretty much at the time had the most research base, and that's why that's the one I chose. There are other forms. Mariva is another form that has a few good studies there too, but probably BCM is the one there's been the most research on, so that's why I chose that.
Excellent. This is probably falling more into the realm of speculation. I don't know that there's been studies on this, but many people have pets that, especially dogs, that seem to suffer depression and anxiety disorders. And they're wondering if you think it might be useful to do a trial in these animals to see if it improves mood.
Yeah.
There's no downside.
Yeah, it'd certainly be interesting to look at. So I don't know a lot about that area, fortunately. So.
I do know that there is a veterinary study specific to this curcumin on dogs, so we know it's safe for use in dogs.
Okay.
But I'm not aware of any studies looking specifically at mood disorders, and I empathize. I used to have a dog a few years ago that had a terrible anxiety disorder. I wish I'd known all this information then, but yeah, I don't see any reason why you shouldn't try.
Yeah, exactly.
Here's a lot of people have a lot of interest, by the way, in brain injuries, and this is wondering if in your paper does it address children who have sports-related concussions that lead to depression?
Children is a really tough. I mean, the area of kind of natural treatments for children is extremely poor. I was really disappointed when I did the study. There are some studies. I pretty much in my paper reviewed all the studies that was available on the natural treatments for kids with depression, and if I only included good quality studies, it would have been a one-page paper. So I had to include everything that I could find and then really just talk about that more research needs to be undertaken. But yeah, I think that if we can target, preventative health is the key. So if we can target brain injuries or depressive illnesses early on, we're going to have far greater success rates. So.
Well, you know, at least in the United States, there's a very highlighted awareness of the fact that kids are suffering a lot of minor traumatic brain injuries by playing contact sports. And in the National Football League, they're starting to talk about the permanent changes that happen with the results of repeated concussions, like the increased issues with severe depression and also with early onset dementia. So I think that that's certainly timely information as far as looking at how can we help these kids. Of course, we should try to prevent it, but what kind of things can we do after the fact?
Yeah, and certainly, you know, curcumin as a natural anti-inflammatory with its good side effect profile, I think it's worth, yeah, for some kids with brain injury to supplement them with some curcumin for a period of time. So there's some logic to that for sure.
Here's a question for Asperger's, which is on the autism spectrum. They're wondering if there's any negative reactions to using curcumin. Would it increase irritability in people with Asperger's who are also depressed?
The only answer to that is really trial and error. So there wouldn't be any research on that at all. So it'd be worth trialing and seeing what the effect is there. So I'd say base it on your experience rather than on any research papers that have been done, that's for sure. So.
I am not aware of any research study done on curcumin on depression specifically in people with Asperger or autism spectrum disorders.
Yeah.
But on the other side, of the papers looking at curcumin and depression, I am not aware of any of the adverse events being listed as an increase in irritability.
No,
so at least
I didn't have that.
Right. So at least in the general population, we don't see an increase in irritability, but you're right, people can have unusual and unique responses to things.
It may be the only, often kids with or people with Asperger's or autism can have digestive disturbances, whether that might flare up some of the digestive problems possibly, but I'd say it's a pretty safe supplement to try.
Right. Here's a question on saffron. Do you have more information or references on saffron? Has there been a lot of work on saffron and depression?
Yeah, if you type in my name on the internet and saffron for depression, you'll see a paper that I've written, and it's a review of all the research on saffron for depression. So if you just type in Lopresti saffron depression, and you'll see a link. You'll find a link to a paper that I've written.
Is this a dietary supplement, saffron, or is this saffron as a spice added to food?
As a supplement. So it's too difficult to only a small amount. People kind of, when I say saffron, people kind of go, oh wow, saffron's so expensive, but you only need 15 milligrams twice a day. So it's not an expensive supplement to take, but certainly that can be used. That way you can monitor it a bit more rather than, I wouldn't know how to measure 15 milligrams from the original
Well,
spice.
it's certainly one of my favorite spices to cook with, so it certainly wouldn't hurt to, if you like the flavor of saffron, and that it would certainly be healthy to incorporate it absolutely into your healthy diet, or look for it as a supplement if you want to give it a trial for depression. And type in Dr. Lopresti's name and saffron, and you will be linked to you'll find his paper on that topic. I'm just scrolling through to make sure that I haven't missed. Are the pathways for depression different in people who have post-traumatic stress disorder, or are you aware of any differences?
There's difference in some of the pathways. So people with post-traumatic stress, there can be differences in the HPA axis, but the pathways, what we're finding with mental health is that there are dysregulations in all those pathways with all the mental health conditions, but whether there's an increase or decrease can vary. Inflammatory processes can vary, but pretty much PTSD hasn't been as much research from in that area, but PTSD certainly has a link with the HPA axis there, so, and a lowered HPA axis.
Here's a question relating to exercise. You talked about the studies on exercise being effective for alleviating depression. Do you have an idea of the percentage of success for dietary supplement interventions, for example, curcumin or saffron, compared to simple exercise?
No, there's no head-to-head study with it. I'd say they're probably equivalent in their efficacy. I mean, I think one of the things we need to look at when we're looking at a supplement or even exercise is that sometimes we're looking for this magic solution, and you know, I think a lot of people, you know, for example, we're really excited about the curcumin, thinking, okay, well, curcumin's going to have this, you know, be this magic pill, but it's a component of an intervention. So I think that if you had curcumin plus did some simple exercise, plus did some relaxation, plus engaged in pleasurable activities, that's going to be the most powerful treatment for depression. I would never treat anybody in my practice and just give them curcumin. It would be a combination of a bunch of different things that would be useful for the treatment for depression.
It's a complex disease that needs a complex intervention.
Absolutely.
You know, I've heard of a lot of other individuals talking specifically about depression relating to, like, you need to boost neurotransmitter levels. But if depression were just as simple as not enough serotonin, we would have cured it by now. There's so many factors that play a role that I absolutely agree with you that instead of saying which, either or, why not all of these interventions? I think that's where we set people up for the best chances of success.
Exactly right.
Here's a question. Were there any negative side effects or dropouts in your study?
There were, I think, 3 dropouts in the curcumin and 1 in the placebo. Now the curcumin, one had to go overseas for an emergency, so that they pulled out. One person pulled out because of reported digestive problems. But once they stopped the curcumin, they had a history of IBS, and once they stopped the curcumin, the IBS continued. But I'd say there's a slight increased chance for digestive-based problems, but generally they'll be for people who have pre-existing digestive problems. So I would, if that was the case and somebody wanted to try curcumin, I would probably just start one capsule a day and just kind of work from there, and rather than go the 2 capsule a day. And go from there. So, but those side effects were similar. You know, headaches were reported in placebo and in curcumin. There was no difference between the 2, and energy levels increased or decreased in both the groups and so forth. So,
here's a question about, and I'm not 100% sure what's being asked, but are you looking at specific blood markers? So I'm not sure if they're asking if you evaluated blood markers of inflammation or blood markers related to depression.
Okay. Yeah, no, so it's another study that's under review, another paper that's under review at the moment. What I haven't talked about today was we also measured blood and urine and salivary markers in people pre and post intervention. So we not only want to look at their changes in depressive symptoms, we also want to say, well, are there changes in their markers? And so we have measured that. We weren't able to measure all the markers that I was hoping for. I wanted to measure a whole bunch of different inflammatory and oxidative stress markers. But what we found, which is again under review at the moment, what we found is that it's quite interesting that people who had high levels of leptin at the beginning of the study did better on curcumin than those that didn't.
Isn't leptin that hormone that's associated with obesity?
Yeah. But it also has several other functions in the body too. So really we need to replicate that. So a few other things that we found in terms of, but leptin's probably the one that people may have heard of. There's other markers that we looked at, kind of endothelin and camp and things like that. So we looked at too, but we did look at that, and I'm going to replicate the study again, looking at blood markers again and seeing whether they change, because that's a really important. That'll be a really important finding.
Excellent. We've had several questions, folks, about the availability of the slides and the webinar, being able to listen to the webinar again. This webinar will be archived on the Terry Talks Nutrition website, which is an aggregation of different types of information about natural medicine and dietary supplements. You will be sent the link when it's up and posted. Give us probably about a day or two before it gets uploaded onto the webinar archive. So if you'd like to listen again, review the slides, or if you have a friend or someone in your life that you think that this would be very, very useful for them to hear, please feel free to forward those links or forward that information. But as I said, 24 to 48 hours we'll have that archive version uploaded onto the site. And this is a compliment to you, Dr. Lopresti, that I've gotten that question several times. So many individuals must either want to hear this again or must have someone in mind that they think that this would be particularly useful for. Do you use, or what do you think about using probiotics in an antidepressant regimen? I know there's a lot of really interesting research having to do with gut microflora and depression.
I think it's certainly an area that requires a lot of investigation. I think it certainly would have some merit. If you have digestive problems, and taking a good probiotic is probably quite beneficial if you have digestive problems and depression. There still needs to be some research to kind of look at whether probiotics are useful as an antidepressant. I think it's promising, and again, I'd say, yep, if you want to take a probiotic, certainly give it a go.
Are you aware of any bacterial strain that's more effective as a probiotic for depression than any other, or has that just not really been fully elucidated in the research yet?
Yeah, no, I don't think they've looked at individual strains yet, so I think they've probably looked at it more generically. So, and the studies have been more kind of animal-based, rat-based studies. So.
Excellent. All right, I'm reviewing the information, make sure I haven't missed anybody. Make sure that I've gotten all the questions. I want to make sure I check both. Let's see. And then, well, I want to share with you, great presentation. Thank you, thank you. Lots of people say thank you for the wonderful information. All right. Do you ever use higher doses of this BCM in certain cases, or do you think that the 1,000 milligram is the best dose?
I'm going to use, if the next study goes ahead, I'm going to have 3 groups, one with placebo, one with 1,000, and one with 1,500. I think there's probably merit in trying 1,500. So
that's interesting. All right.
We'll see how it goes.
All right. All right, just forgive me for silence for a moment while I'm just reviewing,
no, okay.
Make sure I didn't miss anybody's. We have a lively conversation going on in both our chat and our Q&A boxes, and I think that we have taken care of them. Another thank you for the excellent presentation. All right, I think we answered all of the questions this morning. So I appreciate you taking time. It's evening for you and morning for us. It's amazing to me that we can have such a lucid conversation and such an excellent educational event, and we are an entire hemisphere apart. So thank you so much for participating this morning.
No problem at all.
Thank you. And thank you to all of you who took time out of your busy day to learn more about natural interventions for depression and the etiology of depression. As I mentioned previously, this information will be available in our webinar archives on the Terry Talks Nutrition website. That's terrytalksnutrition.com. And you will also be sent a link via your whatever email you use to register for this. We will send you the link in case there is someone that you want to share this information with. Thanks to all of you, and until we meet again, good health to you. Bye-bye.